was getting pain right here at the base of the thumb. And at first it was just an annoyance. Then about a year ago, it started to become something more. As a photographer, I use my hands every day, handling cameras and lenses, putting up light stands, and it requires carrying all that stuff. It requires setting it up, adjusting it, take it down, take it back out, put it in the car. There's a lot of wear and tear on my thumb some days. It was quite painful, but I just kind of lived with it, and I realized I didn't have to, and that's when I visited Dr. Ackelman.
I've taken care of my career many patients like Bill who put up with pain for many years. And when the first time I met him, he came in and said, "I really am hurting."
The first thing Dr. Ackelman did for me was give me a brace to wear to alleviate some of the pain.
In Bill's case, we had treated him conservatively for a long while. He had had conservative treatment with medications and splints. I'd give him cortisone injections. It had gotten to the point where those conservative measures just didn't work anymore.
He then suggested that we talk about an operation.
The surgery I recommended to Bill was a thumb arthroplasty. So it's a relatively common procedure. It's one we've done over a long period of time tested, very good outcomes.
My surgery's coming up in a week. It was explained to me that it's a quick procedure. I'm looking forward to getting better.
In Bill's case, we were able to do the surgery on an outpatient basis. We used a block where we numbed the whole arm that I operated on up. He did not have to have a general anesthetic.
I was very impressed with the staff at Rhode Island Hospital. The day of my surgery, I was taken in right away, right into pre-op. Everything was explained to me. I met the anesthesiologist, the physician assistants. I met Dr. Ackelman. They explained everything that was happening. I was probably no more than a half-hour wait, and then I was in surgery.
We open the base of the thumb through the skin, protect all the arteries and nerves in the general area, and then we surgically dissect around the base of the thumb and take out this entire bone called the trapezium. When we do that, we take a tendon from the forearm up here in the mid part of the arm, and we roll it up in a cushion, and it fits in the space where we've taken this bone out. So essentially we're replacing an arthritic bone with a piece of tendon in the forearm. He was able to come in, have surgery in the morning, and go home at the end of the day.
After the surgery, that pain was immediately gone. The only discomfort I had was from the surgery itself, and that went away in about 3 days. My hand was in a cast for about a month, and the day that was removed, I immediately started the hand therapy with Karen. She gave me an array of exercises to do. I had about 5 weeks of in-person therapy and continues now with exercises at home that she left with me. I've met with Dr. Ackelman twice since the surgery. He's very pleased with my recovery, says everything is going as planned and everything looks great.
Probably in about 6 to 12 months, he'll have an outstanding outcome. He'll be able to function as if he didn't have any pain at all. His strength in his arm will come back. He'll be very happy.
It's been 4 months since my surgery and I'm feeling great. I have no limitations, I have no restrictions. One thing I'm still working on is getting my strength back. Before my surgery, I was having trouble with the smallest things, opening jars, even turning doorknobs would be painful. Sometimes driving, the steering wheel would hurt. And after the surgery, I'm pretty much back to my regular self, doing things without even thinking about them. I would definitely recommend this procedure for people who have this condition. I suffered for a while and I really should have done it sooner. I couldn't believe how quickly my thumb recovered and how I was pretty much back to normal in a short period of time. But as far as the pain, there's zero pain.